how does it work? Basically, a brief overview is that sometimes you'll do priming before your menstrual cycle. So sometimes I would say the IVF cycle even starts before your menstrual cycle. So you would do priming with estrogen or birth control before your menstrual cycle to keep your hormones balanced. When you get your period, then you'll start on these medications to grow the group of eggs. So usually with personalized IVF, that means 1 or 2 pills and 1 injection a day. And you're on these medications for, on average, 10 to 12 days. That's how long it takes for that group of eggs to grow. And while you're on these medications, we always need to be adjusting the doses of medications through. So you don't just take 1 dose and stay on that dose for the whole 10 or 12 days, because as eggs grow, your hormones need to change. And so you need to change the dose of the medication as you're going through those 10 or 12 days. So how do we know how to change the dose of medication? During those 12 days, you're going to come in for what's called monitoring, where you get an ultrasound and blood work. And part of what I'm checking is that FSH hormone, and we're adjusting the medications to what the eggs need through your IVF cycle. So you may come in a few times, maybe 3-4 times for monitoring while you're on the medications. Then when we see the whole group of eggs has grown to the right size, now sometimes they grow at different sizes, so we're always balancing the needs of the eggs growing bigger with the eggs that are smaller. But once we get the group to the ideal size for that group of eggs, what we do is we basically start the ovulation process. So you'll take what's called a trigger injection that starts the egg to grow and mature and begin to ovulate. And then the egg retrieval is about 36 hours later. So we collect the eggs basically as they're starting to naturally ovulate, but before they release. So it's a very precisely timed procedure. You can't, I've had patients where maybe they got stuck and couldn't get there for a few hours later. Usually the eggs are gone at that point. They've ovulated. So it is a very precisely timed procedure so that we can collect the eggs just as they're naturally ovulating. And we'll collect the whole group of eggs. Sometimes not every follicle will have an egg. Sometimes as we're going in to suction out the eggs, not every single follicle that was part of the group will have an egg that we can suction out. So that's something to keep in mind too. But that's how it works. And then from there, the eggs are then fertilized for IVF. Sometimes they can be frozen for egg freezing, but that's about the 2-week process. Now, after the eggs are collected, that's sort of like your natural ovulation day. It would be your natural ovulation day in your cycle, so then you would expect a normal menstrual period about 2 weeks later. So I'm Dr. Jen. I'm a board-certified fertility doctor for those just joining, and I'm talking about personalized approaches to IVF and why they're better than the older high-dose hormone methods of doing IVF. So please subscribe if you want more content like this. This is my specialty, is personalized IVF. I've helped thousands of women with personalized IVF, and it's really a much nicer type of IVF. So I will start to take questions specifically about IVF tonight. So I'm Dr. Jen. I'm a board-certified fertility doctor talking today about personalized IVF, which tends to be a lower dose hormones and fewer side effects, and focused on good quality eggs. So let me know if you have any questions about IVF medications, and stimulation protocol types. So I will take some questions and answers about IVF. Let's see. Okay, so thanks you everyone for joining. Let's see. Poppy says, wife 29 years old, diagnosed with DOR or decreased ovarian reserve, and the fertility clinic said IVF would be an uphill battle. So I don't know if I would call it an uphill battle, but it can take more work, IVF, if you have low egg reserve. And what I mean by that is that sometimes, without knowing her AMH, it's hard for me to say for sure, but sometimes it can take more than 1 egg retrieval to get a viable egg or embryo. So it can take more work. That's what I tell my patients who have very low egg reserve or AMH, that you can get pregnant, depending on your situation. But it can take more work because you have that low egg reserve. And what that means is in that group of eggs, not as many will grow in response to the medication. So you won't be able to collect as many in one cycle. But if you collect over a few cycles, then you'll get that number that you need, especially at age 29. But the other thing to keep in mind is what I'm talking about tonight is this type of personalized IVF, which is important for women with low egg reserve, because if they give massive doses of medication in the IVF protocol, you may see eggs not grow. And what happens again when you have low egg reserve, your FSH is naturally high, and if you take massive doses of FSH injections, it like overwhelms the eggs and they just freeze and don't grow. So I have seen many patients who have come to me saying they had low egg reserve, they did conventional IVF, and the IVF was canceled because the eggs didn't grow. So I know right away, okay, they were taking way too high doses of FSH for their eggs and what their body needed. So make sure you ask about protocols for DOR, and if they have different protocols for DOR than their standard protocol. That's a question I would ask your fertility clinic. Okay, so would I recommend to remove a uterine polyp before transfer? In general, yes. A polyp is an overgrowth of the uterine lining that can cause inflammation and will decrease the chances of the transfer working. So in general, you want to remove, through a hysteroscopy, a uterine polyp before doing an embryo transfer. Tina says, I'm going to have my first egg retrieval the week I turn 39. Am I too old? So 39 years old is not too old for an egg retrieval. I've had hundreds of patients at age 39 get pregnant, doing IVF at age 39. So you're definitely not too old for an egg retrieval. The thing to keep in mind is some women at age 39 will show signs of decreased ovarian reserve. So if that's the case for you, sometimes at age 39, you do one egg retrieval and you don't get the viable egg that's going to grow into a pregnancy, and you need to do a second egg retrieval. That can sometimes happen, not always at age 39, but sometimes that happens at age 39, where you're in that group where it can take a little bit more work for IVF to work. Fingers crossed, and best wishes for your first egg retrieval.